The initiative that we've developed is a cultural commitment to culturally safe care, and it's also known as The Tree. There was about 25 of us that attended a workshop in 2022, and essentially it was developed by all of the staff who participated in that workshop to outline what informs our cultural commitment and how we intend to practice in a culturally safe way. We developed an illustration of the tree, and the resource essentially describes how our culturally safe care is informed. So the roots of the tree are the things that keep us strong in the work. In the centre of the tree is our core value around safety, commitment to family and being an intentional workforce. And the branches of the tree represent the scope of practice for violence, abuse and neglect. And the falling leaves of the tree actually represent continual learning and development.
I think for me, the outcomes have been much more openness and humility around how we navigate conversations around cultural safety, and shifting our views away from being culturally competent to being culturally humble, which has been a huge shift in our services. I think this initiative really supports our non-Aboriginal clinicians to feel confident in navigating some of those conversations and reducing some of the fear that if they lean into some of those conversations, they may get it wrong. Using the model is in its early days, but from my perspective, it has really supported increased engagement of Aboriginal children, young people, adults and families accessing care. By being open and having conversations about culture at the start of people's engagement with us, it really sets the scene for a positive, safe, culturally and clinically effective intervention.
Our project is the Aboriginal Early Childhood Screening Clinic, where we screen children aged 6 months to 6 years for audiology and speech pathology concerns. We know that speech pathology concerns and audiology issues can really impact children's ability to attend school, and we've found statistically that Aboriginal children who have these concerns early in life and that aren't addressed are less likely to complete school and are more likely to require health service intervention in the future. The outcomes of the project are that we've been able to identify quite a few children who could benefit from early intervention. The children that we've identified through our screening project have been able to get in to see ear, nose and throat specialists. Some children that were told by their GPs that they would need to see an ENT and go on the public wait list were able to not actually see them, that they can be treated either by seeing our audiology clinic, seeing a private audiologist, or maybe they've just got some speech concerns that can be done through treatment. We've seen children that haven't been screened or seen, even received their early childhood screenings from their Blue Book since birth. By having these clinics in our Aboriginal Health Unit, we're able to build a feeling of trust and openness and provide a location that our families are able to come to that are safe, and ensure that their ongoing relationship with the health service is one of mutual trust and respect from both sides that hopefully will mitigate any issues or trauma that they may have had in the past. Early intervention, early diagnosis, appropriate diagnosis, reduction of wait times, all of those contribute to how efficient our program is.
Reach in the Home was developed a few years ago to support families upon discharge. So when we're doing discharge checks on babies, we do inform parents that the yellow sticker in their book, their Blue Book, has our phone number on it, which goes directly through to the experts, the team leaders in the nursery, who can give them advice 24 hours a day, and parents are quite relieved when they find out that this project is available.
This program's improved the experience for families because it's a safety net when they go home, because they know that they can just call and get expert advice and opinions, and that they will be welcomed directly back into the nursery for their baby to be reviewed if that is determined necessary. We have up to about 500 babies a year where the parents either phone into the nursery and or present to the nursery for help following discharge from their birth admission.
One of the great benefits of this program is that parents who don't have necessarily a sick child, they're just struggling with feeding issues or sleepiness, have an avenue where they can come and see us. We can give them reassurance and admit the baby if they need a bit more help with feeding and things like that, or give them the tools so that they can go home and care for their child at home.
We've had a couple of babies that have come in from home directly to the nursery that have been critically unwell, including one that had to be retrieved to a tertiary neonatal centre. And then we've also had lots of babies that have come in with less significant concerns. We've had babies this week that have come in via this program requiring intravenous antibiotics and other treatments. Reach in the Home has improved efficiencies for the hospital. It's ED avoidance, because a lot of these babies would otherwise present to ED.
I'm so proud that when I'm doing the discharge check on babies that I get to tell parents that this service is available for them. It's great because I see a look of relief on their face that they know that 24 hours a day they have someone they can contact that can give them expert advice.